So this chronic pain, it can be isolating, but if you have it, you're hardly alone. By some estimates, 1.5 billion people worldwide suffer from chronic pain.
The road to relief can go through all kinds of doctors' offices and tests like MRIs and CAT scans, and for some, operating rooms. John Pennington took a detour, though, before undergoing surgery.
He did, and he's here along with Dr. Drummond of Spinal Balance Health Center. Good morning, gentlemen.
Nice to meet you, John.
Yes,
Welcome back,
John,
Dr. Drummond.
I heard you were in bad shape when you went to see Dr. Drummond. So how long had you been in pain, and what were the symptoms that you were experiencing?
I was in pain for about 24 years.
Oh, John.
A long time.
Yes.
So what was going on exactly?
Well, back in '89, I had back surgery, and it was basically a back surgery. It didn't work.
So, and then doctors at some point recommended additional surgery for the
Yes.
pain?
Well, I've been diagnosed to have I've had epidurals, I've had a lot of everything.
Where was the pain? How severe was it, and how did that affect you on a day-to-day basis?
On a day-to-day basis, I went to work and got through it, and after that, I was wore out. I didn't have any life.
Sometimes doctors will say on a scale of 1 to 10, how's the pain? What would you have assessed that number at?
10.
For years?
Yeah.
For 24 years?
Yes.
That's amazing. And Dr. Drummond, you've said he was one of the, sort of not the worst patient, but in terms of cases.
One of the most
Probably
severe
top
cases.
5 that's walked into my office as far as the level of pain and how much of his life had been
that's
taken
unbelievable.
away.
Top 5 most severe cases that
Yeah.
you've seen. So what did you see in him that made you think, I can help this guy?
Well, like anybody else, what I'm looking for is an upper cervical misalignment that is causing the posture to go out of its balanced position, then just putting stress throughout the whole system. It's probably the most common health problem that leads into his type of symptoms. His were just worse. And that's exactly what he had, was an upper cervical misalignment.
So I'm thinking about, he's already had surgery years ago. He continues to go to doctors, continues to fork over. I can't imagine how much you've spent over the years trying to get relief.
We were talking about
so like,
that in
here
the other
he
room.
is, this extreme case. How is it that something so gentle as NUCCA care could be as effective as it has been for him?
He went to a lot of doctors in the past that were treating him symptomatically, and there were underlying issues that were causing the symptoms that were never addressed. And there honestly aren't that many doctors that do it. In upper cervical care, what we do, we look for a misalignment at the top of the neck that is interfering with the nerves that control the muscles. Because poor joints and bad posture and a stress structure, it's not caused by the bones and the joints and all that. It's caused by muscles not holding the body in the correct position. And that's what was happening with him. It was that top of the neck issue interfering with the way the brain and the body communicate.
Well, I guess it's common then to see so many different symptoms from one specific issue then.
Yeah,
And that's kind of what
I
you've
think
seen.
there's even a figure here that we've got where there's a picture of 2 people beside each other. Here on the right, it shows the muscles pulling a body into a nice balanced posture. And on the left side, it shows exactly what an upper cervical misalignment does, that it causes muscles on one side of the body to tighten more than the other. And once that happens, you have to adapt. And in adapting to that, it takes your whole structure out of its normal position, and that added stress just causes the body to wear out over time. So if you can correct the top of the neck, the whole body straightens out.
Well, so you can see
and
the
start healing
spine,
again.
the length of the legs. I mean, the whole body really is affected by
It
this.
does make sense. So now that you've got that body on the right, John, how are you feeling? What happened after you started to see Dr. Drummond?
I could walk. Before I couldn't walk. I had to just struggle through, even if I went to Walmart or something like that, I had to have a cart to actually hold me up.
Well, to get around, and then the
Yeah.
pain on top
Yeah.
of that. I mean, that's difficult. So how rewarding is it now to be here after you saw Dr. Drummond and your family?
Excellent.
How are you feeling?
Wonderful. I mean, this guy, if it wasn't for him and my wife, I wouldn't be sitting
You
here.
wouldn't be sitting here.
Do you feel any pain? Are there any symptoms?
Oh, I still have pain. Not as intense as it
It's
was.
manageable.
Yeah, and you've talked about that it's a process.
Yeah, and I asked him in the other room, I just said on a scale of 1 to 10, if 10 was the worst you'd ever felt, and 0 is perfect, where are you at? And he's down to about a 3.
Yeah.
Wow.
So, but when you get severe cases like that, it's not a flip-flop. What we're doing is getting the body's own natural healing mechanisms working for a person again. But he's getting better instead of continuing to get worse.
It's not a cliche to say you've changed his life.
No,
I mean,
it's
I
not
don't
at
think
all.
that's an understatement. So
No.
it's got to be rewarding for you to see him walk in.
Yeah,
and
it's
changed.
fantastic, especially compared to it, mentally where he was at. He was an angry old man when he walked into the office. And we see it all the time.
And
But
smiling.
he's one of the nicest guys you'd ever want to meet, but he'd had so much taken away because of the pain that he didn't want to be in my office. He didn't think it was going to work. It was I mean, thank his wife. His wife got him in there.
Not too many doctors call their patients angry old man. And John's smiling about it. Dr. Drummond, how do you know if somebody's a candidate for NUCCA out there? I mean, if you have symptoms of pain.
If you know what to look for, it's not that difficult. I need to just look at a person's posture. There are certain characteristics with the posture that will tell me if one side of the body is tightening more than the other and forcing this adaptation. And then if I see those indicators, I take an x-ray, and then I can actually measure the misalignment and cater a correction specifically to that person's needs.
It's a lot of math and science.
Yeah, it's all geometry, physics.
Yeah.
It's more like spinal engineering than it is.
Would you
anything
recommend
else.
it?
Yes.
Yes.
And I tell anybody that I see that if they're having back problems, see this guy.
And before you have surgery, because this is non-invasive, it's remarkable. And in fact, Dr. Drummond brings us a special offer for those of you who are compelled. You hear John's story and you see yourself in that, even if it hasn't been 24 years, even if you're not at a 10, but it's affecting your life, you want to do something about it. Dr. Drummond gives us this special offer for the first 15 people who call. It can't be unlimited. When you look at the value, you see why. You get this whole bundle for $50. So let's show you a phone number. That way, if you want to call and take advantage, you can. It's 452-3400, Spinal Balance Health Center in Omaha, the Millard area there, and online at spinalbalancehc.com. Congratulations, John.
Yeah,
Thank
John,
you.
great to see you doing so well.
Really great.
Good to see you, Dr.
Dr. Drummond, thank
Thanks
you too.
for having us.
If maybe you tuned in late today, you missed hearing about our Barry Manilow ticket giveaway. Would you guys want to go? You go see Barry Manilow, some Manny, some Copacabana. You could see his one last time tour live when it opens in Omaha. Register for your chance to win tickets by Friday at 10 a.m. at omahamorningblend.com.
I knew Dr. Drummond was a fan of Low.
I can play Copacabana.
CASA for Douglas County advocates for children in the foster care system because of abuse or neglect.
Next, the importance of volunteers and why more are needed.